All right, hello everyone, and welcome to today's Kinder's virtual shadowing session. Today it's going to be an OT session by Jessica and Ali, so I'll hand it over to them.
Great, thanks, Leah. Hi everyone, my name is Ali, and I will be co-leading this session with one of my classmates, Jessica. So before we begin, I just first want to acknowledge that I'm currently living, working, learning, and playing on the unceded ancestral and traditional lands of the Coast Salish, including the Musqueam, Tsleil-Waututh, and Stolo nations. As well, Jess is currently residing in Kelowna on the unceded traditional lands of the Okanagan Nation. So we are both first year Masters of Occupational Therapy students, and we just finished the first week of our second placement. We won't be directly covering what placements look like in our presentation today. However, if you do have any questions about either how many there are, what they might look like, the requirements, or maybe just our general experience, there will be some time for questions at the end, so you can just hold on to those until then. We're looking forward to sharing the next hour with you all to talk about occupational therapy and answer any questions to the best of our ability that you might have for us. We are hoping for this to be an interactive session, so please stop us if you have any questions or comments throughout. You can either just turn on your mic or you can type something in the chat and we'll try and get to that as well. And then again, as I said, we'll have like a Q&A session at the end. So if you want to hold on to your questions till then as well, that's totally fine. Also, just a disclaimer to bear with us. Neither of us are at our usual setup right now. So kind of monitoring two different devices that aren't connected together. And then just with the Zoom world, hoping that the Wi-Fi stays stable. But yeah, we're hoping to not have any technical issues, but you never know. So please just be patient with us if there is any. Excuse me. So just to give you an overview of what the next hour will look like, we're both gonna do a bit more of a proper introduction of ourselves. We will go over the application process to the program at UBC and what that might entail and what it looks like. We will also go over what occupational therapy is to give hopefully a more concrete definition and help you kind of differentiate it from other professions. We'll have a short case study at the end to hopefully consolidate some of the knowledge that we give you and work through a common practice that occupational therapists work in. And then again, we'll have the Q&A session at the end. So I will let Jess introduce herself to you all.
Okay, thanks, Ali. So hi, everyone. I'm Jessica. I graduated from UBC with a degree in psychology in 2019. And then I took a year off. I did, all my prereqs that I needed, which we'll cover later on. And then also in that year that I took off, I worked as a behavioral interventionist, and then I volunteered in a long-term care facility. And then with that, I applied to the UBC MOT program, and now here I am. So as Ali mentioned before, we are currently on our second placement. And so I am doing my out-of-town placement in Kelowna. And I am in the hospital setting, and I am in inpatient rehab. So those are, pretty big words. Like I didn't understand it when I first started OT. So if you have questions about it or questions about, what field, what fields you can work in OT and like what the hospital setting looks like please feel free to ask us later on. I'm also an international student, so if there are any international students here and you have questions about the application process and what it looks like being an international student, feel free to reach out and ask. And yeah, I'll pass it on to Ali to share her introduction now.
Great, thanks, Jess. So as I said, my name is Ali, and I graduated from the University of the Fraser Valley with my bachelor's in kinesiology in 2020, and then I was accepted into the MOT program in the fall of that same year. Throughout my undergrad, I got my experience through coaching gymnastics. So I coached children and youth with neurodevelopmental disabilities, among some other conditions. And then I was also a volunteer coach for a Special Olympics team. Yeah, I'm also again in my first year of the MOT program. The placement I'm currently on is in Abbotsford. I'm at the Fraser Valley Child Development Center, so I'm working in a pediatric setting, specifically in early intervention, which means little kiddos from birth to about 5 years old. And I also had done a previous placement up north in Prince George, working with individuals in the community setting with physical disability as well as mental health challenges. So if you have any questions about any of those, feel free to ask at the end. I'd be happy to chat about it a little bit more or clarify anything that you might be wondering. I won't bore you all too much about going in depth about myself, so we will move on to the application requirements, and I'll pass it back over to Jess.
Okay, so for UBC specifically, there are quite a few requirements that have to be done to apply. And so the first one is you need either volunteer or work hours. You need 70 hours minimum at a maximum of 2 facilities. So for me, I did like 40-ish hours in like when I did my behavioral interventionist job, and then I got another like 40 hours from volunteering. And it has to be with people with disabilities, and that can be like cognitive disabilities, emotional, or physical. And then you do need 3 references. So typically when you volunteer or you work, you would ask them to give you a reference. I think it's 2 academic references, so your profs, and then like 1 external, like either work or volunteer. And then you need a minimum average of B+, which is a 76% or above on your like recent 3rd and 4th year courses. The competitive GPA is
Jess, I can't hear you. Oh, Jess?
86. Oh, hello.
I'm not sure if that was just me that cut out, but I couldn't hear you there for a sec.
Can you hear me now?
Yes.
Okay, did I cut out?
Yes, you did.
Okay, where did I cut out?
You were just talking about maybe pick up from the competitive GPA.
Okay, so the competitive GPA is 84%, but the minimum requirement to apply is a 76%. So, you know, if you're around there or you're unsure if like, oh, I don't know if my GPA is good enough, I would encourage you to just apply anyways, because OT looks at more than just your grades. And so yeah, just apply. And even if you don't get in the first time, like just going through the process is very helpful and would help you in the next year. So yeah. And then we also have to do prereqs. So the first one is human anatomy. So from UBC, I did CAPS 391 if you're a UBC student. And there are like a list of other things. I'll put it in the chat, like the requirements. Here it is. And you also need a social science. So 1 course from either sociology, anthropology, or human geography. And then 1 from behavioral science. So any psych courses of any level. And then, yeah, I put the link in the chat and you can look at all the requirements there, and it tells you like what courses count for human anatomy or social science from all universities in Canada, I think. So yeah, now I'll pass it on back to Ali to talk more about the process of applying.
Yeah, so these are some like external things that you will do in your application. So the first thing, it's called the Casper test. It's around, I believe, 12 video or text based scenarios. It's a situational judgment test. It's non-academic and it's more assessing your attributes or your people skills. And this is not a UBC specific platform. So you might notice that if you apply to other universities in Canada, that you'll also have to complete the Casper test. You only do it once, and then you can pick which universities you want your score to be sent to, just in case that's helpful to know. In terms of preparing for it, it's helpful to look up some example ethical questions or scenarios to practice, guide your thinking in this format. And I believe there's also some practice questions on their website. So if you just Google like the Casper judgment or situational test. You should be able to find their website pretty easily. Yeah, and then also in the application, you have a written response. So you're given a prompt to write a short response about. It's only 250 words. Our advice on this is to make sure that you're answering the question very thoroughly. So just really read the question and understand what they're wanting you to talk about, and just be yourself. They're not looking for a specific answer or anything like that. They really just want to know your authentic response to the question. So don't try and get in your head too much thinking that there's a right answer. It's really just your personal response. And then, as Jess was mentioning, there are 3 references that you're required to submit. So 2 academic, and then typically the other one is work or volunteer. You have to submit your transcripts. I believe if you are a UBC student that this is done automatically. Yeah, okay, perfect. And then around, I believe, mid-February, at least that was our experience, you will find out if you were selected to do an interview. So the interview consists, as of right now, it's a 3-person panel. Typically, it involves like a faculty member, a clinical faculty member, and a current or past student of the program, just to give you some context to what that looks like. And yeah, so that's basically the involvement for the interview. And then you would find out in some time frame, I don't think more than a month after, if you have admission into the program. So did you have anything else you wanted to add there, Jess?
No, I think you covered quite a bit.
Awesome. Yeah, and then that link down at the bottom there, Jess put it in the chat. Again, that's just admission requirements, and you'll see most of this information written on the website as well. It's pretty easy to navigate. So next, I'm just going to introduce the next slide first in case it's a video, so I'm not sure if it's going to start playing right away. We are going to show you all a video. It's just kind of a basic overview of what OTs do. We thought it did a really good job at explaining it, probably to the same degree that we would be able to, and sometimes it's fun to watch video. So we will play that for you all. Joseph, maybe you want to give me a thumbs up if you can hear the volume once I start it.
Okay.
When your health changes, it can feel like you are always waiting on the next medical professional, the next symptom to emerge, the next treatment to begin. It can feel like you are always waiting for the next thing to happen to you. But at the core of occupational therapy, we believe that no matter what comes your way, whether it's an illness, an injury, or disability, you and your loved ones still have the power to influence your health in the ways that matter to you. Occupational therapists know that a vital part of healing is staying involved with the life you have worked so hard to build. And that means finding ways to engage in the activities you love and to spend time with the people that you love. We know that even when your health has changed, you are still a mother, a driver, a teacher, an engineer, an athlete. We work with you and your loved ones to help you heal, to help you get stronger. And when it's necessary, we help you choose the best technology and equipment to help you stay involved. That's because occupational therapy is all about keeping you at the heart of the matter. We work with you and your loved ones to help you live a life you love. To learn more about occupational therapy, visit otpotential.com. When your health...
Okay. All right. So we thought that video gave a pretty good overview. And now we're going to tell you a little bit more about what OTs do, although some of the things that we're mentioning, you'll see were also discussed in the video. So first, OTs, I think a good statement is just that we help people do things that are important to them and the things that they need and want to do in their life. So we really want to enhance their participation and engagement in those day-to-day activities. One of the frameworks that a lot of OTs use kind of look at this participation in 3 different domains. So we look at self-care, which is, as you can see on the screen, washing, eating, dressing, toileting. So self-care, we really consider those like basic daily needs. So washing, such as things as just like hygiene, so washing your hair, washing your body, brushing your teeth, just being able to maintain like a clean person. And then also eating we look at. So not just the physical active eating like chewing or using utensils, but also helping people maintain their independence in this area. So being able to prepare their own meals, cooking, grocery shopping, just anything related to eating. And then dressing, if someone has a cognitive impairment or have recently had changes in their physical abilities, we help people maintain their independence in dressing. And then toileting as well, you know, it's a basic daily need that everyone wants to be independent in. So making sure that people are able to use the washroom um, independent and providing any adaptive strategies or equipment that can help them do so. And then we also look at productivity, which is mostly just a fancy word for work. So this is if somebody, this could be their occupation in regards to employment. It could also be productivity in the home, so home maintenance. If they're a mother, maybe, or a father, and they're driving their kids around, making sure they're still able to do that. If you're working with children, school in itself is an occupation that we look at in regards to productivity. And even like little kiddos play is a big productivity for them, and that's how they learn and explore their world. So making sure that these individuals who may have challenges doing so are able to still engage in those productive occupations. And then leisure, everyone has those activities that they really enjoy and they're just for them and they get a lot out of it. Especially I think right now we've noticed mental health wise, people aren't able to do all the leisure activities that they're used to doing, especially in regards to social participation. So just finding different ways for people to maintain their leisure activities. And these could be, again, like hanging out with friends or gardening, running, sports. The list goes on and on and on. I'm sure we all have our leisure activities that we love to do. So helping people maintain their engagement in those is also another area that OTs look at. So I'll pass it on to Jess to explain some of the other things as well.
Yeah, I think a really big like misconception of OT is that the word occupation or like occupational, a lot of people think like, oh, it's job therapy, like you're helping people get back to their jobs. And that can be, you know, one aspect of what OT is, but I see occupation as things that occupy your time. And so, like Ali said, it encapsulates a lot of things like self-care and productivity and, you know, some things we do without thinking, like if I had to change or I had to go out, I would put on my shoes and I would go out. But for someone who, you know, had a stroke, like maybe they have like hemiparalysis on one side and they can't do that. And so what OTs do is we, you know, we find creative solutions to help them get back to doing those things. So we do that by changing the environment, like maybe making their house more accessible so that they can still live in their home and they don't have to move out of their home. Or like using adaptive equipment like a reacher to help them put on their pants, or like a shoe horn to help them put on their shoes. And like, you know, sometimes in the washroom, like we don't think about it, we just use it. But you know, someone in a wheelchair, it can be really difficult. So we can, you know, use a grab bar so that they can do that by themselves and they don't require help from other people. And so they can, so that they remain their, like have their dignity still kind of. And yeah, we just focus on like problem solving different things of like, how can I help this person get back to doing that if they have limited range of motion? So yeah. And OTs, you know, we work in a lot of areas because it's really broad, but you can mostly see them in like hospitals or like private practice clinics. You can see them in schools, in home and community, which just means that the OT would come to your home and look at your home and make that space accessible for people. And then we also play a really big role in mental health and getting people back to doing those things. So yeah, OT is a very like holistic and like meaning focused. We look at what's meaningful to people because, you know, maybe someone you think, oh, this person needs to put on their pants, so I'm going to help them. But maybe they don't want to put on their pants by themselves. Like maybe they want to paint. And so we look at things that they want to get back to, and then we help them with that. So with that, we will now go over a case study where, you know, you can try to apply some of the things that we, you know, talked about here to the case study. So Ali, if you wanna. Okay.
Yeah, I can introduce our case study. Jess is gonna put a link in the chat so that you can have the case study as well as some of the things that OTs do that we just went over open when I change slides so that you can refer back to it if that's helpful for you. Yeah, so now that we know a little bit more about OT, we're going to try and apply it to this case study together. And full disclaimer, Jess and I are still learning a lot about OT ourselves. It, as you can see, is a very, very broad practice profession. So we by no means are experts, and there's never one right answer to a case study. We both find that paper cases are very difficult, and a lot of the times you are making assumptions because you don't have that person there to talk to find out what's meaningful for them. So just keeping that in mind as we work through this case together, that even if we talk about things that you might not be thinking of, it doesn't mean that a suggestion or a thought that you had was wrong, because there's definitely more than one right answer. So that being said, let's imagine that you had a client named Richard Weber. His pronouns are he, him. He's 42 years old and was referred to you because he experienced a stroke to his right hemisphere 6 weeks ago. Because the right hemisphere was affected, we can expect that he's going to be affected on his left side. He was discharged from the hospital and is now attending outpatient OT services in the community. So as Jess mentioned, outpatient community is when the OT comes to your house to work with you. Just to give you some context there. He's been taught. Sorry, go ahead.
Oh, sorry. I was just going to say, because I also did outpatient right now, and it can also happen in the hospital. Like
yes,
you can
correct.
come into the hospital, but you just don't stay there. So
yeah, no, yeah, that's correct. Outpatient can be outpatient in hospital or outpatient in community. So just making that distinction is important. So in this instance, it's outpatient community. So us, the OTs, are going to Richard's home to work with him. Okay, so he has been taught different dressing techniques to dress independently and perform his self-care activities. He's been working with a physiotherapist to walk independently, and he's determined to do this safely. However, he's still experiencing some weakness in his left arm, as well as some memory challenges, including remembering appointments and completing tasks. He's eager to return to his daily life. Richard is a professor at UBC. He enjoys cooking, playing baseball, and spending time with his family. And he would like to get back to doing those things as soon as possible. Since he is left-hand dominant, this makes things a little bit more challenging for him. So remembering that his weakness is on his left side, and that is his dominant side. So just keeping that in mind as we work through the case study together. So we have some questions for you all to think about on this next slide here. So again, if you want to pull up that document that's in the chat, it'll keep the case study open for you. So yeah, we have some questions here for you to think about, and we're hoping that some of you will feel comfortable to share your answers. Again, there's not any right or wrong answer here. OT is very creative, and it's just problem solving and coming up with different solutions. So feel free to type ideas in the chat, or we'd love it if you'd like to turn on your mic and chat with us, but also encourage you to use the chat as well if that's more comfortable for you. So Jess is going to introduce our first question for us.
Okay, so given the case study with Richard Weber, and he's having left-sided, weakness, or let's just say he it's not functioning the same way and he's having difficulties with that, what activities would he specifically be struggling with? So let's think about, his work. He's a professor. What are some things at work that he might have to use his left hand for, and how is that impaired now? Cooking. I don't know many people who cook with one hand only. So in what ways would that be difficult for him with only one hand? Baseball and, his family life, what does that look like? When would he need to use his left hand? How is he having difficulties with that? So we'll just give you some time to, think about that. Ask questions if you need some clarification or if you have some ideas of what might be hard for him to do. Yeah, feel free to put that in the chat or unmute your mic, but no pressure. I don't like to unmute my mic either.
Yeah, so we'll give you guys a few seconds to think about that and just pop any answers you might have in the chat or unmute. Try not to overthink it too much. So I sometimes find it helpful to imagine yourself in the scenario. If you had weakness in your dominant hand and you're trying to prepare a meal, what might be difficult for you?
Well, maybe I can give an example if that makes that easier.
Yeah. Oh, there we go. David, if he uses his left hand, yeah, exactly. He might have difficulty throwing a baseball, writing. Yep, definitely typing. Yeah, you guys are definitely
good ones.
Got it. Those are the ones that we immediately thought of as well.
Yeah, thank goodness I didn't give my example because these were my examples. So thanks for
Yeah,
trying.
cutting things for sure. Yeah, it's hard to stabilize if you only have one stronger hand, especially if it's your non-dominant hand. And then that's a safety consideration as well, is are they safe to use utensils and sharp knives?
Yeah.
So I see, I was just going to ask about what about his family life? Definitely carrying his children. So his children are older, but that's such an important consideration if you do have younger children, if you need to be carrying them. Yeah, driving's a big one.
Yeah.
Great. Yeah, we'll let you guys keep going for a little bit. Let's see what else we can think about. These are all pretty much what me and Jess had thought of as well, but I love hearing everyone else's responses because sometimes you guys think of things that we didn't even think of ourselves. So
yeah, cool. Yeah, these answers are great. Like, like OT isn't complicated. It's like you're just breaking down a task, right? Like what do you need to do something, and then you break it down and then you problem solve step by step, and that's what OT is.
Okay. Do we feel ready to move to the question, Jess? That sound good?
I feel
like you guys covered all that very well. Those are exactly what we thought of. Handwriting might be an issue. Yeah, definitely.
Good one.
So you can imagine how difficult that would be if all of a sudden you can't use your dominant hand. It impacts your life in a lot of ways because it's often something that we don't think of. Okay, so our second question is, we know that he has weakness in his left side, and you all addressed that very well in your responses here of how that might impact him. Oftentimes people who experience a stroke or have some type of brain injury, they can also have some cognitive deficits as well. So that's what we're hoping to think about in this next question, is how might, it specifically said he's having some memory challenges, impact his day-to-day function. So still thinking about his work, cooking, baseball, family life, how might challenges with memory impact his engagement or his participation in his life? This one, it might be a little bit more challenging. Yep, that's definitely teaching can be hard if you don't remember the material.
Yeah.
Common recipes.
The recipes one is a good one. That's what I thought of too.
And even regards to recipes, like the sequencing of how you might cook a meal. I'm going to turn off the stove.
Yeah, Megan, that's a really good point. Safety is, especially in a hospital, when you're trying to discharge them from hospital, you're always thinking of safety. Like, can my patient go home and be safe and like not burn down the house? Like, can we trust that they know how to take care of themselves? So
Remembering the rules of baseball. Yep.
Yeah.
Forgetting appointments, definitely, especially not just appointments for yourself, but appointments for the family or even picking kids up from school.
In
Yeah.
tasks, in work and daily life, interpersonal problems,
Yeah.
forgetting the names of family members can be frustrating. You know what? That's a really, really, really great point, because I recently worked with a patient who had a stroke and it affected his language center of his brain. And physically he's fine. And he came in and we were talking to him and he was quite emotional. He was like, oh, like, I feel so dumb. I can't even remember my kids. Like, I see them and I recognize them, but I can't remember their names. And it's almost hindering his social interactions because he's so scared to embarrass himself because he can't remember their names. So yeah, like, that's a really, really good point and very relevant.
And a lot of the times those are the things that are most meaningful to people. You know, maybe sure they're not remembering their appointments, but if they're not remembering their family or kind of their family responsibilities, that might be a priority for them because that's what's most important in their life. So it's really just finding out what the individuals you're working with, what's meaningful for them and what they want to be able to do. Because as you can see, we can think of a whole list of areas they might need support in, but it's teasing out which ones they want to work on and what their goals are. Even if you feel like that might not be a priority, it's really about being client-centered and making sure that you know their goals, because at the end of the day, you can recommend all different techniques, equipment, but if it's not meaningful to a person, they're not going to use it. And then it can also like dampen that relationship between yourself and the people you work with. So always keeping that in the back of your mind. So I just see a few more in the chat here. Tasks, interpersonal problems, as Jess was just saying. Ingredients for grocery shopping, that's definitely a good answer as well. Great, you guys covered that very well.
Ellie, I think we might skip the third question just because a lot of these answers kind of cover like his impact on his family. So
we can jump to number 4. So how do you think we could help Richard with cooking, considering his left-sided weakness and memory difficulties? So as some of you have mentioned, cooking is an area that he may have difficulties with, remembering to get the ingredients, safety considerations, how to cut up food, remembering a recipe. So what are some strategies that we could work on with Richard to help him with some of these difficulties? I'll give you all a moment.
This one is a little harder, I think.
This is a little harder. Physiotherapy, teach him to write down sticky notes. Yep, definitely. That's a good memory strategy. Sticky notes are definitely helpful for some people. Yep. I'm curious about the physiotherapy. I don't want to put you on the spot there, but physio is definitely, it is saying that he's working with someone for his mobility. Help him instead.
Adaptive cooking tools is great.
Yeah, that's a really good one.
Labeling the cupboard so that he knows where everything is. That's also really great. Y'all are like thinking like OTs already.
Yeah.
It's really
Training
great.
his left side to become stronger is a really good one. And there's different ways we can do that as well. It depends on the injury, if it's neurological or if it's a muscular injury, depends on which route you're going to go down to do that. But there's definitely different ways that we can help his left side get stronger, for sure. That's a good suggestion. And these are all things that we thought of as well and some that we didn't think of. So it's always good to see y'all's responses.
Yeah.
Maybe we'll give it 30 more seconds and then we can move on to the next slide. Assist his family.
Asking his family. Yeah, I'm using the social supports in his life and, delegating tasks, having a planner. Kitchen gadgets, some kind of cutter.
I've noticed a few comments about bringing in his family, and that is a big, if people have those support networks, that's a really big resource to pull on. It's always important to check with your client first if that's something they're interested in, if they want that support from their family. Because in some cases, people might feel like they're a burden and they don't want to include other members of their family. So always making sure that you're checking back on the individual, that that's something that they're interested in. But definitely a
Yeah,
huge
that's a good
resource
point.
if those supports
Mhm.
are in place.
Yeah, for sure.
Okay, well, I think you guys
Now,
have
why
a
don't we?
very inclusive list there. Do we want to move on
Yep.
to the next one, Jess?
Yep.
So yeah, great answers. These are probably going to sound very familiar, some of the OT-based solutions that we thought of. And we're also just going to run through the whole OT approach very briefly. So we will always start out when you're first meeting a client with an interview. And again, this is just to find out what a typical day looks like for this individual, finding out about anyone in his life to support him. What does spending time with his family look like to him? What are the activities they do? Also looking at their home layout, if this works for him, or if there's any challenges. And this is very important for OTs because we always consider how an individual's environment impacts their participation in their occupations. And if there's any adaptations in the home that we can provide or suggest that are helpful to them to just have an easier home life. And then we also want to observe their overall presence, their insight and their judgment, and also any signs of mental health concerns. Typically with the stroke, it's a major change in someone's life and they may experience depression or anxiety, and it's really important for OTs to address this. For example, how do you motivate someone to cook if they have a low mood and they don't want to get out of bed? So it's always important to remain with that holistic view that it's not just maybe their physical or cognitive limitation, but they're a person as well. And this is oftentimes you're helping people with a major life change. So always keeping that in the front of your mind when you're meeting with other individuals. And you can always refer out to other professions if you feel like that is appropriate. We also do assessments. So this is to determine an individual's goals and what's important to them, and keeping the client at the center to help them do things that are important to them, not just things that we want to do as OTs. So we can do functional assessments to see how an individual is doing in day-to-day tasks. So for example, you could watch them dress, you could watch them cook a meal, or perform any self-care activities like brushing their teeth, showering, toileting. For example, with Richard, we could specifically watch him cook a meal and look for those physical challenges or those memory challenges that were mentioned. In this specific scenario, there is specific assessments we could do, but we won't go into that. But there are things that you can look specifically at memory to help you guide your interventions, or there's specific functional assessments as well. But we won't go into that. It's too much for today. And then, as we mentioned, if Richard gives consent, we can gather information from his wife and children to see if there's any challenges that they notice that we don't know from Richard, because oftentimes those people that are close to the individual you're working with can provide you with a lot of helpful information as well.
Yeah, thanks, Allie. I'll go on to talk about the interventions, and honestly, a lot of the things that you all came up with were a lot of things that we came up with too. But I'll just briefly touch about it. But so for cooking, some things we can do is teaching him one-handed cooking techniques. Teaching him to stabilize the cutting board with one hand and be able to do that by himself. We can use adaptive devices. So one thing in particular is a one-handed cutting board. So if you look in the picture there, it kind of is able to hold your vegetables or whatever, and you're able to still do that one-handedly. And yeah, like we can even incorporate other aspects of his life. So we know that he enjoys spending time with his family. And so we can incorporate his enjoyment of spending time with his family into cooking. So maybe cutting is really difficult for Richard because, he has to use his non-dominant hand. So then in this case, maybe his wife can do the cutting, the kids can, set the table, and then Richard can like stir the pot or stir things in the pan, Like you can always just think of it in a way that he's still independent in some aspects and then, drawing on other aspects of his life. And, you can also think about like meal delivery, like, like those like HelloFresh or take out the plate or whatever. And then The prep time is just easier and it's less of a cognitive load given his memory, and they always have like the recipes laid out. Yeah, so those are just some things we thought about for cooking. And then for return to work, we can do a gradual return to work program. He doesn't have to do like 5 days a week. He can do maybe 2 days a week for 3 hours, and then you build on that. So 3 days a week and 4 hours. And, consider COVID, the world that we live in now. And, with technology, like things are online, and maybe that can help him like not think about the left-sided weakness as much. And a big part of OT, as we mentioned, is just breaking down the task. So just now when we asked you like for work, what does he need? And a lot of you said he needs to write, he needs to type. And so that's what we would do. We would find out what tasks are required as a professor, and then we break it down. So we like to say that clients are the experts in their own life, because I might think, oh, a professor needs to do this, this, and this. But maybe for him, he's like, actually, no, being a professor, I need to do this, this, and this. And then we'll help him with those things. But yeah, we can teach him, one-handed typing strategies, and, writing down his schedule to help his memory, as someone mentioned before. And I think someone also said, teach him to write down sticky notes, which was a really good idea. But you also said physiotherapy, which a lot of the time OTs work with physios. It's not a one person thing. We collaborate with the physios, we collaborate with the speech language pathologists, and we all kind of work together to support the client. So yes, like the physio can help them with range of motion, and the physios can help them regain strength, but OTs can do that too. Like we can help regain fine motor skills to help in writing, and teach like different memory strategies. So it's a very holistic approach, and it's always a multidisciplinary team where we are all like working together to support the client. So yeah, I'll give it back to Ali.
Yeah, I think that's a really good description there, Jess. I would definitely agree with what you've said. I'll just very, very quickly go over interventions for his family involvement in baseball. You all pretty much said what we had written down in our notes already. So again, just finding out his level of involvement in his family. A big thing that I have noticed on placements is considering adjusting your parental roles. So if he had previously done a lot of the cooking, maybe he does more of the housework, or some things that might be a little bit easier for him as he journeys through his recovery. And then encouraging to spend time with his kids and finding out what spending time with his kids looks like. If he's a coach for a team, maybe that's something he could continue to do. And just really finding out what's going to work for him. But everything else I had written down here, you all already covered, so I won't repeat it. In regards to his leisure activity of baseball, you can discuss what this looks like for him. What were the positions he played? What were some of the tasks he needed to do for the team? And then we come up with strategies with him to continue to participate and really keep those social relationships, as we've mentioned, are so important to a lot of us. And just gradually introduce activities. Maybe he can start by keeping score if that's something he was interested in, or picking up the balls, collecting bats, and then slowly beginning to coach and throw the baseball. And a lot of the things, the really neat thing about OT is we use occupations as therapy a lot of the time. So we will use those activities that people enjoy to do to help them regain their independence back, rather than a typical therapy that people might think about when they hear that word. I think a big takeaway I've had from one of my professors is that this person is on their own journey, and that we are just on this journey with them. They are steering the boat, and we are just following them along and helping them along the way. But at the end of the day, it's their journey, and it's our privilege to be able to join them on their wherever their path might take them. Jesse probably knows what I'm talking about when I say that. But it's a very big takeaway that we've had. In general, I hope we didn't overwhelm you all. Sometimes we go on a little bit of a tangent because we're very passionate about the profession. But honestly, this is just a very small snippet of what OTs can do, even though it might not feel very small right now. But we do extend so far beyond what we have mentioned. But this is a very classic or typical scenario that OTs learn about and that you'll see in hospitals. So we thought that this might be a helpful one to help you all get a better understanding of occupational therapy, as we do know the definition can sometimes be a little more muddy than clear. So with that being said, we have about 15 minutes left. That's all we had to share with you all today. And so it's time for some questions. You can ask us anything about what we just talked about, the application process, our experiences on placement, or our experience in OT school at UBC. Or if there's something that we didn't cover that you're curious about, please just ask us. We're going to do our best to answer any questions. Again, we are by no means all knowledgeable about the field, but we're happy to answer any questions you have. We do have our contact information up there as well. So feel free, if you're not comfortable, to type it in the chat, to shoot us an email. We will get back to you as soon as we can. We both are on placements right now, as we said, so we're a little bit busier than normal, but we will do our best to answer you to the best of our ability. If you don't feel comfortable answering or asking a question, or if you think of some after today's session. So I see there's lots popping up already. I'm going to start with Jade. Okay. What did you guys do for volunteer work that you found was helpful in school? Yeah, that's a really good question. You have to work with individuals with disabilities, so it can be physical, emotional, cognitive,
or emotional.
I don't know if there's any one right answer to that. I think just getting experience in the field is really helpful. I personally worked with kiddos with autism and cerebral palsy, as well as just anxiety, a whole bunch of different ones. That was my experience. Jess, I'll let you speak to yours.
Yeah, so I put a link in the chat of like UBC's list of volunteer opportunities. And that's kind of where I started. And you can also, honestly, it doesn't have to be with UBC. If you just, Google volunteer opportunities and stuff like that, like it will come up. What was helpful though, I worked with, like Alia, very similar. I worked with as a behavioral interventionist. So if you like kids, I recommend that. And I worked with kids on the spectrum. And then I also worked in a long-term care facility. But how is that helpful? I think just, being familiar with people with disabilities and learning to like be respectful and to communicate was what was helpful in school. But honestly, we learned a lot as we went. Like we didn't know a lot coming in, and you will pick up on the language, and you will, gain a more professional identity. And what are some of the pathways some of the pathways one can pursue after MOT?
Just to clarify this question, is this like more schooling or more of a like professional practice that you might go into?
Yeah, I guess I'm curious. Is this question asking like the areas an OT can work in, or other things other than OT that we can do? So Julie, if you want to clarify that. But we'll move on until you do.
Okay, yeah, so
what are some...
sorry, Julie answered us. She said professional pathways. So I think a lot of fresh OTs go into the hospital setting. So there's a lot of support in the hospitals, and you're going to be working with a lot of OTs that are experienced, from what I've heard. So would you have to go to med school? To go? No. So to get into the OT program at UBC, you just need you need a bachelor's degree in any field. And then to meet those prerequisites that we outlined earlier. And that's the only requirement to get into OT.
I think if you're asking more like professional pathways, people who study OT and, practice OT, they love it. And typically if you do OT, I don't know anyone who has studied as an occupational therapist and then not gone on to practice as an occupational therapist, but you're also equipped with so many skills that you could really do anything you want. I mean, if it, like you can't just jump into physio or you can't be a doctor, but like you have a lot of people skills, and likely if you go into OT, you probably really like working with people and you probably end up in a field working with people. So I don't know if that really answered your question.
Yeah,
but,
I hope we answered your question. I think other than the traditional occupational therapy practice that people go into after grad, other routes you can do, like you could become a professor, or you can work on different
research.
Yeah, I was
You can
gonna say
you can go into
or
research.
boards that approve, like WorkSafe, I know has OTs that work for them that review like equipment recommendations. So there's a whole bunch of different areas OTs can work in, and I hope we answered your question there, Julie. If we didn't, please feel free to reach out to us and we will try to do better to clarify that.
Okay,
but we are
next
going to jump to the
question.
next one just for time's sake.
What are the similarities between the job of an OT and a physio? Okay,
This is a very
similarities.
common question.
It is a common question. Actually, it's not common. People usually ask about the differences.
That's true.
And similarities.
I know it really depends on the setting.
It does.
A big crossover between OTs and physios is mobility devices, so walkers and canes. And from my understanding, in the hospital setting, that is strictly a physio role, and then the OTs are strictly wheelchairs. However, in a community-based setting, your OT may also prescribe, or not prescribe, sorry, but look into walkers with their clients. Also, functional electrical stimulation. I'm not sure if some of you may have heard of that. It's the like electric electrodes that stimulate your muscles. I'm not describing it very well. I'm not super familiar with it, but I know that is an area of practice that both physios and OTs do as well. So it really depends on the setting you're in, but there is some crossover in the professions. Jess, did you have anything you wanted to add to that?
I think a big one also is just working on that range of motion.
Yes.
They both do that. Like they both try to increase range of motion in a safe manner. And in the hospital, the lines between physio and OT are more distinct, but I think in community it's a little more blurry. But I would say a difference would be like OT is more like functional aspects of the movement. So if I'm limited to this, like what can I do with this? You know, like how can I put on my shirt if I can only do this? But a physio would help you try to increase that. But OTs can do that too. So it's, it's blurry. But okay. What extra?
I'm sorry, I'm just looking at
extracurriculars did you have?
Alan's question. Oh no, sorry,
Ivan.
No,
so what extracurriculars did you have in high school? I was on honestly, your extracurriculars in high school,
I think that more applies to your bachelor's application.
Yeah,
honestly,
they didn't. They didn't look at our high school.
I worked a lot in high school.
I did.
So
I didn't ask about high school.
That. Yeah, I think if there's a really relevant experience that you did in high school that carried through, you could mention it, but I wouldn't worry too much if you didn't have a lot, because I personally I worked and that's it. So
I just did a lot of sports. Like I didn't do anything like related to working with people or anything. I was on a lot of sports teams, so that honestly it wasn't very relevant to OT, but I don't know if that answers your question.
I think both Jess and I honestly didn't know about OT till about my second year of university. So it wasn't even on my radar when I was preparing to go to post-secondary. So if this is something new that you thought of, don't worry about it. I didn't decide I wanted to apply until near the end of my third year. So it's definitely doable to get yourself prepared for OT school, even if you decide later on it's something you want to pursue.
Okay, we are short on time. Let's keep going. So what was the best way to obtain academic references? As I know that it is often harder to reach out to get to know profs in university. I honestly just asked. Like you kind of need to be a bit thick-skinned. Like a lot of professors are very used to writing academic references. Um, so you just need to ask. And even if they say no, it's fine. Just ask a different professor. Like you just have to get over that step and just ask. And
Yeah.
you know, they typically say yes, and they'll ask you more about yourself, like maybe give them your CV or something and tell them why you're doing it or why you enjoyed the course that they're teaching. And they'll ask you like, oh, what is your GPA or what are some of your extracurriculars? And they're very used to writing it, so just ask.
Yeah, I don't
Like,
have much
just
to add to that. Just they
do
will,
it.
if they say yes, they'll ask for any information they want from you. I think it's helpful if you've taken more than one of their classes. So maybe a professor that you've been in their class with quite a bit could be helpful. But I agree with Jess. You just got to do it.
Just ask.
I see a few
moving
questions
on.
about majors, and a lot of common majors in our program is kin and psych, but by no means does that mean you need those undergrads. It's for a reason that there's no specific undergrad you need. The program really prepares you to go into this field regardless of your background. There's people in our program that have fine arts degrees, biology degrees. So it honestly, as long as you meet the prereqs to apply, the program is very well laid out to set you up for success.
Yeah, I definitely agree. And if you're thinking more like, oh, does one have an edge over the other? I actually don't think so, because OT is so holistic. Maybe the kin students might be a little better at the anatomy aspect, but then maybe the psych students might be a little bit better at like the social aspect, but then maybe like, you know, the fine arts would be better at like being creative with the assistive devices. Like honestly, like you can come into it with a blank slate and you will just learn so much. There's like it balances out. Like you never feel like someone knows more than you or anything. So
and it's helpful to draw on your classmates if they're stronger in one area than the other. It's very team-based approach in the program, we find. Sorry, I didn't mean to cut you off, Jess, but we have a couple minutes left and I think just a couple more questions. The hardest part of working in OT. Personally, I think it's not letting things weigh on you, especially if you're working in a mental health field or working with people who've experienced trauma. I think it's separating you have to have those supports in place and people that you can debrief with to kind of help deload yourself at the end of the day, because sometimes you will be working with people who have gone through major life changes or experiencing quite significant struggles. So I think that is probably one of the biggest challenges in any healthcare profession, I would want to say, is just being able to not disconnect, but leave work at work, so to speak, but also still being empathetic and with the individuals you're working with, but also being mindful of your own mental health and taking care of yourself as well.
Yeah, for sure. Like going off of that, like you'll meet, you know, some of the nicest people and they probably have a lot of trauma and experiences. And, you know, I think the hardest part is like trying to keep calm when you feel so emotional for them and you feel so empathetic and you still want to support them, and knowing and trying to assure them that progress doesn't look the same for everyone, especially when you have a disability. Like some days you'll do really well and then the next day you'll regress. And so just being able to support that, and but it's also very meaningful. I think the hardest parts are also the best parts.
I agree.
It's really what you take of it. So okay, let's move on.
Two more.
We're actually
are we okay to answer maybe these last two questions, Leah? And then if anyone has any more, please just send us an email. You can send it to both of us or just one, and we'll get back to you when we're available.
We can also say,
I won't put a time frame on it, but yeah, we can hang back.
We can hang back, and if you have any questions, we'll answer them. Did you guys often know the profs prior, like visiting their office hours? The ones that I asked, I did go to office hours. And yeah, he didn't know he couldn't remember my name, but then he recognized my face, so he still gave me a reference. So I don't know if that helps you.
Yeah,
Um,
personally,
yeah.
sorry, I went to a smaller university, so I did know most of my profs just because of class sizes, but I wouldn't let that deter you from asking, because a lot of the time, you might think they don't know who you are, but they will. They can also look back at previous coursework, or I think profs know their students more sometimes than we think they might. So I wouldn't, even if you haven't gone to their office hours, let that deter you from asking a specific prof. As Jess said, just ask. Worst that happens is they say no and you ask someone
They
else.
say
But I
no.
often
Yeah.
don't know how many times profs say no because they want you to pursue your academic passions. So I don't think no is a very common answer.
Even if you don't go to office hours, like maybe try to email them about some kind of assignment or question so that they know your name at least.
Yeah.
Like don't just randomly like shoot your shot. Like make sure you have a shot, you know.
Okay, I
last
see
question.
one more. Major sciences.
Anatomy.
Yeah, anatomy would be very helpful if that's something you can take.
Actually, you have to take. You have to take anatomy.
Yes, you have to take anatomy. But I know it's just one anatomy course that's required, but if you can take a couple extra ones, or even like brain anatomy, so some neuroanatomy would be good.
There are specific ones you have to take though, and we linked like the requirements in the chat.
Yeah.
It's
you
like
can
a
also
higher
just
level
Google
anatomy.
like UBC MOT application into Google, and the website will come up. I personally didn't take physics at all.
I didn't either.
I am not a mathy person. So I think the best suggestion we could make is just look at those prereqs. But other than that, I'm not sure. If you really enjoy physics, take it. It could help you. There is probably some instances where it could be of benefit to you, but it is not a requirement to get it. Hopefully that answered your question.
Yeah, you don't need it.
Yeah.
We do. Yeah.
I think a lot of it will depend on the program you do. Sorry, I'm just going to mention this program you do your undergrad in. So if you're in a program that requires you to take physics, it's not going to harm you. It's a requirement for your program currently, but that very much guided what courses I took to prepare for the MOT program. So I wouldn't worry too much about that, just knowing your prereqs.
Yeah.
And also just a disclaimer, our MOT cohort really loves memes. So that's why we put these here. That's like almost our identity, I think, the 2022 class. So hopefully you guys enjoyed them.
Yeah, that looks like all the questions. So thanks for having us, everyone, and like listening to us talk for over an hour. We talked a lot. Yeah, thanks again, Leah, for hosting us. Yeah. And if you have any questions or any anything, just reach out to our emails and we'll try our best to get back to you.
Yeah, we will get back to you hopefully in a timely manner, but we won't put a time limit on that just because
we are
where we're at right now. But it looks, I'm not sure where you're all situated, but it looks like a very nice day out where I am. So hopefully you can get out and enjoy some sunshine. And yeah, we'll be respectful of your time and wrap it up there.
Thanks for coming and talking.
Yeah, of course.
A lot. Okay, I'll just stop recording now. See you guys on the see everybody who's attended on the next Kintern session.